This is Christine Porter with the Times News. I'm here today with Dr. Marianne Smalley, a physician in the emergency room at Lehigh Valley Hospital, Carbon. We're talking today about the reasons people come to the ER over the holidays.
What are some reasons that people end up in the emergency room over the holidays?
We see an upswing in heart attacks over the holidays, and that's actually been pretty well documented. The American Heart Association put out a paper about it recently that the weeks between Christmas and New Year's are the highest for heart attacks in the country. And I think that there's thought that people are visiting, they're out of their element, they're having a different routine, they're also busy, that they're eating on the fly, eating differently than they normally would. Some people have pretty strict diets about salt restrictions and fluid that they abandon, during the holiday festivities. Also, often they just get off of their routine. They don't take their medication as they should, or maybe they leave it at home when they're traveling. And all of that can lead to, strain and stress on the heart, congestive heart failure with pretty severe breathing difficulties. And unfortunately, Christmas Eve, we start seeing, fatal heart attacks and quite a few of them, and it's pretty devastating. They also don't want to come to the hospital at that time of year. Nobody wants to be hospitalized. Nobody wants to spend half of their day on Christmas Eve sitting in an ER or the days leading up to it. But often if people would come in a little bit sooner, the outcomes would be better. So we end up putting people on ventilators quite a bit and having a lot of major heart attacks with pretty catastrophic results.
I'm sure someone who's maybe having a little chest pain, maybe they're thinking, oh, it's nothing, it's something I ate, indigestion. How can they know that, oh, this is really something I need to go take a look at?
So, we all experience indigestion, and the holidays are, prime time for that. But if it feels like there's something wrong, people often know. They have a feeling that this feels a little bit different. Things that are particularly concerning to me is, where is the pain? Are they feeling it in their neck? Are they feeling it down into their arm? One of the things we always say in the emergency room is, if your patient is sweating, you should be sweating. And sweating does not go along with indigestion. If you're sweating, feeling lightheaded, like you're going to pass out or dizzy, and we just need to sit for a minute, those are not symptoms of indigestion. They're concerning symptoms, and something like that would warrant a call to 911, not just a visit to the emergency department. People between the ages of 40 to 60, obviously the older we get, the more risk we have for heart attacks, but they feel silly. I think I just overate. I'm sure I'm fine. I'm not really old enough to be having a heart attack. And they often say in the hospital, I'm sorry I came, I feel silly. And there's the people going to get a catheterization because their EKG or their blood tests clearly show that they've had a cardiac event. Something happened to their heart, likely a heart attack. And so I would encourage people, if, not to blow it off. If something feels wrong, seek out medical advice. Call someone, even if it's as simple as calling, your cardiology office. They have someone on call and someone available.
Stress in seeing family and stress with getting everything done and ready for the holidays also have any influence on bringing on a heart attack?
Stress leading to true physical emergencies, also to emotional emergencies. We see, a pretty big increase in depression and psychiatric illness around the holidays as well, whether it be, strain from just trying to prepare, overdoing it, spreading ourselves too thin. Or there are a lot of people that just don't have a very supportive home life with family or friends, and not everyone's family is involved. And that can lead to a lot of depression, suicidal thoughts, people coming to the hospital for suicidal ideation, and even, unfortunately, people taking their own lives without giving warning necessarily, or without reaching out to anyone first. Come to the hospital early if you're feeling that way. There's hotlines. We have, psychiatric and behavioral health services all throughout Lehigh Valley system, with people waiting to help.
What other types of things, or is there any other types of things that frequently end up people in the ER?
Um, so sure, yeah, there's accidents and injuries that come along with the holidays. People are more out and about, especially this year. So even just general basic car accidents. We see a lot of people falling off ladders trying to put up Christmas lights, which is unfortunate, and people who are on blood thinners can be devastating. A lot of really bad broken arms and legs and things like that from falling from attempting to put up decorations, like finger cutting and things like that from cutting food and cooking and burns and those kind of things. And they're all exacerbated when you add alcohol into the mix, which is something that also is common during the holiday season. So sometimes it's people just drinking a little more than they should. Sometimes it's people who really don't drink much during the year, but now they're feeling festive. And they just don't necessarily know their limitations. Oh, it's fine, I can climb up that ladder. Or worse yet is when people feel like they're probably well enough to drive, and we see a big increase at this time of year with drunk driving accidents, which, with all the holiday travel and all the highways in this area, they're usually pretty serious and often fatal. We also see a lot of like accidental ingestions by children. A 3-year-old takes a blood pressure pill, and that can be fatal, especially if it goes unrecognized. Also, people don't always childproof their home. Their kids are grown. They didn't think about putting away cleaners and things that kids can get into. And some of these things smell pretty good. At a party or a big function, the kids are all playing. You don't necessarily have your eyes on your 2-year-old at all times because so many people are around. And that's when, similarly to the summer when drownings happen, but in winter, it falls downstairs. Falls from places that just don't have the child proofing, and then ingestions as well in the pediatric community. So that's something else to watch out for.
So it sounds like some preventative measures is to just be, cognizant of your limitations and keep an eye on the kids.
Right. And honestly, some of it is with the heart problems is, we all deserve to have a drink and to eat a little bit more, but to do it within moderation. So if you know that you're going to have a big dinner on Christmas, don't skip your medicine. Make sure you're taking it on time and say, I choose to have this, so I will avoid having that. I won't have a big meal all day. I'll have, more healthy meals and one meal that's a little bit off. But people just tend to, it snowballs. One thing leads into another and you're having a good time, and then suddenly you're not feeling well. Try to stick to your diet a little bit more with, just a little bit of cheating. And if you notice that you're having trouble, seek help, get medical attention soon. It's much better to spend Christmas Day and one day in the hospital than it is to be in the ICU for weeks at a time and maybe not survive.
It's, last year we really didn't have much in the line of flu, kind of everyone, kids at home instead of in schools, etc. Are we seeing flu in the community?
Certainly, and for more than a month now. And the flu this year I've admitted quite a few patients with the flu. We're seeing a lot worse. We're seeing people much sicker with it, and there's thought that could be that we just haven't been exposed. I mean, people really were isolating themselves for a year or so. It certainly will be worse after the holidays because people are together, everyone's just fatigued with wearing masks and keeping their distance and avoiding, large gatherings, and that's understandable. We all just want to be close with our friends and family, but just exercising, some distance. As silly as, it seems to people, wearing a mask in your house, washing your hands, wearing a mask when you're not eating with your family, depending on who's in your family, that can be a big deal because often young, healthy people, especially those without, vaccinations, they don't necessarily have very many symptoms, but they're spreading a lot of virus. So if you have an elderly grandparent, even if you say, well, grandma is vaccinated people are getting COVID, and most of them are doing fairly well with it. But a little bit of short-term masking and things like that could be helpful.
If your gathering is going to have some unvaccinated people at it, that those people maybe should consider getting a COVID test the day before just to be careful because a lot of times they don't have symptoms. And if you're getting together with people who may be more at risk for serious illness, just as a precaution to protect those in your family who could have a worse outcome.
Certainly, and I absolutely agree with that. And after 2 years of being the person who wears the mask at my family functions and gets tested over and over again so that I'm not making people sick, it's exhausting, and I'm tired of doing it as well. But I often see patients that they had a party and their children are there saying, my God, my teenagers were sick, we didn't know it, and now look what's happened. And it's hard to live with, it's hard to deal with, and then of course it's hard on the patients who get so sick. So as much as it is exhausting for me to constantly be the person who's wearing a mask, working, coming from the emergency department, I sleep well at night knowing that I'm protecting my family, I'm protecting the people around me.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.